So I think a lot of what I'm going to say has been said already. Like, obviously, the jewel is aimed at a lot of the same things. So I might freewheel some of this conversation a little bit. Just to give you background about what we do. So we're a telehealth clinic. Like I say, insurance companies see us as a primary care clinic. We want frictionless billing to insurance companies. We have about 10,000 members in active care, 80-ish providers. If I look at my Elation bill, we're currently in 9 states, and we're a startup from 2015. So we're going to be starting our 10th year. And in November and December, we were cash flow positive. So like we made it. And so we figured out how to credential, how to bill, how to give care, how to keep members engaged. But we're doing it, what I would say, by the skin of our teeth. Our margin is enough to be cash flow positive. But if we scale, everything's going to start to break, right? And so what I say is we have 101% problems. I have a 1% onboarding problem. I have a 1% credentialing problem. I have a 1% follow-up problem, and add them all together. And if I have 100,000 members, my Slack channel will be so uncontrollable that everybody will cry when they open the computer. And so when I look at our development roadmap, people use the boulders, rocks, sand analogy. And there's an appearance that you can get sand in the jar, and you can only get boulders in the jar. We have to switch video platforms because Twilio is getting out of the business. Okay, that's a big boulder. We have to switch this big boulder, and then all the sand sits there, and the sand is the 101% problems. And if we're going to succeed, we have to nail that. So I went to our engineers and I'm like, can you abstract all the rules so I don't have to go in your development cycle every time we need to change something? And they're like, sure, here's a tool. I'm like, can you show me what happens after? Well, that's a different build. Can I edit it? No, that's a different. So if I ask my team to build rules extraction, it's big and expensive. And that's another big boulder that I can't fit in there. So I was looking for rules engines, and I saw that post or whatever, and I got what Awell is. And so if I were to summarize from a business perspective why I know we have 101% problems, we have 50,000 chats initiated. Well, it's a little misleading number. Every time there's a dialogue back and forth, that's a count. So there's 50,000 back and forth conversations from our members to us every month. That's bad, right? And I don't really know why. It's appointment, it's medication, it's I need help, it's I'm lonely, it's 100 different things. And we didn't have good systems to see that. And so how to prioritize my 1% list, I didn't have it. So I needed a system where we could make 10 1% things and keep on trying and iterating, because it's going to be a long problem. Other things that are funky about what we do what's called shared medical appointment. So I have a clinician and a behavioral credential person in a session with 5 to 10 people per hour. So scheduling problems, technology problems, noting problems, automation problems. Super good efficiency from cost of service, but lots of 1% that you add into there. And then again, going back to the engineering, do we go to them to say, help me improve this process? Do I reduce the seams between Elation and my drug testing system and my XYZ system, Asana, which we use for task management currently? Or do I build new features for my new addiction, protocol that I want to do? And we never get to build new features because we're always doing the other stuff. So this is when I got to Workit, we had a proprietary EHR, which was pretty good, and a proprietary everything, because everything we did didn't fit. I couldn't get 80% out of a vendor, and I had to customize it 40%, right? And I only want to customize 10% at most if I'm buying from a vendor. So we went and found good vendors. Elation is great for our note-taking and billing beginning machine. I use Candid for RCM and Collectly, which is an awesome solution if anybody uses that. We have a native app that we use, that we build. We use Customer IO. We have router stackers kind of underneath here connecting a bunch of the stuff. And I work at Central. So I have 10 years of layers of paints of rules in Workit Central. So we have drug testing. We do addiction care, so we drug test all the time. In Ohio, I randomize it. In Michigan, I have to do by appointment, 24 hours before appointment. So I have different rules by state. And then each year the rules change. So I have to go on my dev team. And so I wanted to take that out. So basically, I'm trying to put as many things in the externalized rule space so that the teams that manage these different things can work without my engineering team. So I can focus my engineering team on bolder stuff and let the other teams do whatever. Now, we started in November. It's more technical than I thought. It's not no code. It's not, like I made the analogy, it's not Wix. You can't just go build your website. So as I heard people talk about, I had a team that built its care path, they ideate the care path in my interpretation, but building it is complicated. Like there's so many things that could not trigger or overlap. So just make sure that you aim people at this who understand data and connections and multiple systems. Because I think anybody in this room who's thinking about this has multiple systems, right? You're not in a one-horse machine. You're in a connected ecosystem. And you don't really know what the data is or why this token is not accepting when I switch environments and things like that. It's going to be a long haul. I'll talk about some of the things that we're working on. So our most obvious thing is interacting with our members. 50,000 people coming and saying, hey, I need something. So how do we do pre-appointment information gathering? How do we do post-appointment information gathering? How do we make it seem member-friendly? Awell is perfect for that. 24 hours before, a week before, go get this and stick it in Elation. We write notes, we do all these different things. That one's free. So we're going to do a lot on that. Member monitoring. This is something that is huge for us. So we bill monthly. And if you do 1, 2, or 3 things monthly, I get to send the plans a big bill. And if you don't touch us, I don't get to send a bill, right? So I need engagement every month, and I need more than just visiting my provider. Check-in, care coordination, drug testing. So I need non-live interaction monitoring. Did all these people do a drug test? Did all these people do care coordination? How do I make those lists? So I'm doing member monitoring. And then we're doing member and provider satisfaction. Who are our providers that are getting the longest duration of engagement? What are they doing differently? What's their time spent? All that kind of stuff. Awell is going to be one of the tools that we use to think about how to do that. And then community. We have a rowing digital community, addiction recover, AA groups, think AA groups online, right? So 24/7, and the content that goes in there has an infinite amount of red flags. How do we monitor this? How do we know when to go get emergency care, get clinical care, get somebody who's, at the edge of their whatever to have somebody respond? Should we use AI? Should we use humans? And what's the legal risk? All that kind of stuff. There's a whole bunch of things we could do in Awell land to monitor that with AI, just basic rules with keywords, a bunch of stuff. What's next? So this is on my wish list, which anybody has a perfect idea from this. Prescription refill management. So there is a drug that's a synthetic opiate that we prescribe for people who have opiate addictions. If you get it, you very likely won't take opiates that month. If you stop taking the synthetic, you go to the street. So it's literally life and death of people who are on this or not on this. And if you miss an appointment, you miss your criteria, and your prescription lapses, you chat. And you chat and you go to MA, and the MA goes to the provider goes to the MA, and the M. So think of how many touches that is. So if I can monitor everybody's prescription, you have 7 days left. You have 8 days left. And the data is technically in Elation structure-wise, and SureScript sometimes responds with some data, like, was this filled? How many days are in there? Do we know how many days left? All that kind of stuff. If I could get the perfect, you have 5 days left of whatever, that would be a huge major thing for us as far as compliance. So that's one thing that I want to figure out between how Elation stores data, what's really in there, is there some smart logic, all this kind of things. The provider workflow seats. So providers gripe if they think you think you're fixing their problem, right? If they think you're doing something versus you responding to their ask, it's night and day. So we have to earn trust with providers that when I get new systems, it's beneficial to them. So if we use AI Note Assist, they resist it first. Why are you doing? Are you just logging everything I do? Are you using this to track, or are you using this to help me? Is it another system? All the different things are task management. We just have to, no matter how many systems we have to remove the seams, not make it seem like another system, and always make it seem like it's something that benefits them, not the man or whatever, because they're a skeptical bunch, and you have to earn it bit by bit. So our prioritization of things that we're doing with Awell is lame in some ways, because we're not tackling the bigger problems first. We're tackling the smaller ones, because we're just kind of layering on, trust me, I'm not screwing with you. Trust me, I'm not screwing with you. And then we'll do some of the bigger ones. RCM rule monitoring. We got to cash flow positive because we figured out RCM, but it's a constant battle. So, Priority of New Jersey doesn't like H0047. Why? I don't know. So they stopped doing it. So you have to code it this way, and you have to do your DH code like this, not like that. And I could use AI to say, this is my note, this is my diagnosis code, this is what it went in, and for this plan, swap it before I drop it to Kim, right? So like so many things that I could do there that today we're doing in old-fashioned Kim. And I just want to put a thing in there. And that is plan by plan, nuancy thing by nuancy thing. It's perfect for externalized engines. And then the AI assisted tools. We do something called peer review note reviews. So a provider spends, I think we do 30 or 60 minutes a week to review somebody else's notes. And they're all candy canes and lollipops. Oh, this is great. You're great. You're great. You're great. And they don't do RCM. They don't say, oh, you used the wrong note template. They don't do that. They're just saying, good job. I like the way you did this. And so I want to use AI to be like, hey, from an RCM perspective, you get a 7 on 10. From a note to note each month, I have some provider that if you compare characters, they're nearly the exact same identical note, except for the date, month to month to month to month. And it looks, if you look at them one-to-one, that they're fantastic. But their text expander, I think, is one button, like the whole note. And so how do you monitor that? How do you score that? There's so many different ways to do it. And you could do it in a way that looks like you're being helpful to the provider. So my first thought is to say, I'm only going to show this to the provider, not the boss, not the overseer. Hey, you missed an opportunity on RCM. This looks like your last note. You might have copy and pasted too much, and have it be an additive tool. So it's not pajama time and those types of things. So we're far from there. And like, ideally, I'd love to have to respond to our chat machine. Hey, I'm feeling lonely. Hey, let me talk to you. There's so many opportunities, but we're a million miles from that.